Friends and my dear viewers. This is Dr. Kiran D. Shekhar. I am an obstetrician and gynecologist and infertility expert. I've been practicing in the field of infertility, test tube baby and ICSI procedures for about the last 30 to 35 years. Actually, test tube baby technology is not very new. It started about 45 years back when in England, one Dr. Edward and Septo, they made a baby outside the body. That is called as in vitro fertilization. That is, whenever the egg and sperm meet, they meet inside the female body. That is, fertilization and the union of the egg and the sperm takes place in the fallopian tube. But what they thought is, if the fallopian tube is blocked and the lady is not becoming pregnant because of the blockade of the fallopian tube, then they used to remain infertile. So what these scientists thought was, about 50 years or 60 years back, is why not we make a baby outside the human body in the lab and then grow it for a few days and put it back into the uterus, because the tube is not functioning. So this is how this technology started, and this technology from that time has grown by leaps and bounds, and now you have millions of babies all over the world born by this new technology. Now in this technology, what we do is, actually, if the couple or the parents who want to have a baby have been married for 3 to 4 years and their ages are also increasing, they're crossing about 30 years of age, so that slowly the fertility potential of such couples come down drastically. And if they try later on, that is in the late 30s, that is 38, 90 or 40 years of female age, then usually the result is not very good, and then we have a very low pregnancy rate. For the male factors, the male person can give sperms right up to the age of 55 to 60 also, and then age is not very important for the male partner, but the age is very, very important for the female partner, so that before her eggs finish in number, which we again cannot freshly make, then we have to do this test tube technology early. Now, so many innovations and so many new research has been done in this field of infertility, and slowly, the technology started helping us, where we started freezing the eggs, and then now we freeze the embryo also. What is an embryo? An embryo is actually a union of the sperm and the egg. So when you take the egg out of the female partner and fuse it with the sperm in the laboratory, or you actually make a small hole in the wall of the egg and then put the sperm inside, it is called as an ICSI procedure. So when you do such a procedure, you grow the embryo to about 3 days and put it back in the uterus, or you can grow it to 6 days also, where it becomes multiple cells, and you can actually then put it back into the patient's uterus or the female partner's uterus. Or if excess eggs are there, like we are allowed only to put 2 embryos nowadays, so if we have more embryos than 2 in number, then we put it in the we freeze these embryos. How we freeze these embryos is, it's called as a procedure of vitrification. We take the embryos, put it in a straw, and then the embryologist will plunge it into liquid nitrogen, which is actually having a very low temperature, and then this actually will be done at a minus 197 degrees centigrade, and these embryos can survive for another 10 to 15 years also in that. And whenever the patient wants a procedure of transferring those embryos into her uterus, this can be undertaken after bringing the embryos to the room temperature and thawing them. So legally now we are allowed to thaw these embryos even up to 10 to 15 years we can keep it inside, and then finally more than 15 years we cannot do it according to the latest consensus. Now the new techniques which I told you about are there present in all the IVF centers, and these IVF centers make use of the freezing of the embryos. Supposing the patient or the female partner at that time, the conditions are not suitable to transfer the baby into her uterus, then we freeze the embryos for few cycles, like 2-3 months, make the lining of her uterus better, and then transfer the embryos into the mother, would be mother, and then she becomes successful. The frozen embryos also have a very good potential for pregnancy, and they become very strong embryos when compared to the fresh embryos, and we get very good pregnancy rates. Sometimes in the patients who are having PCOD, that is polycystic ovarian disease or syndrome, we get lot of eggs and lot of embryos. So these embryos cannot be actually, more than 2 cannot be put back into the patient. So the rest of the remaining embryos will be stored, and then in the next cycle or the natural cycle, we will put back those embryos back into her uterus on day 6 of her day 6 after she gets the progesterone injections. So this new technology I brought to you because patients who are coming from abroad, and they were actually having an IVF cycle where supernumerary embryos or more embryos are obtained, then the next cycle cost becomes less for them. If they make an agreement with the clinic and they say that preserve our embryos and pay the fees for that, then these embryos are preserved by the doctors at the clinic, and then they are transferred at a later date. So do not be confused or do not be worried about what will happen if my embryo is frozen for a very, very long time. Nothing will happen to that embryo. The embryo stays like that only as long as you keep it in the the proper medium and then freeze it at a very low temperature. It can remain for years together. We need not worry about that. Only thing is, it has to be labeled properly. It has to be actually kept in a very scientific manner. And whenever the lady and the couple will come and request you to transfer my embryos back, then it can be done. So this new technology I brought to you so that couples or some of you who want to do this technology, it is available in our center, and we usually cryopreserve these embryos for a long time sometimes, or for the next year when the patient wants to come and conceive the next year. So the cost of the IVF also comes down. So this is another strategy which I am bringing for you. Thank you.